Ottawa tonight is committing $1.2 billion in new funding to Indigenous communities. The money is to help continue fighting the spread of COVID-19, and it comes at a crucial time, with Indigenous communities being especially hard hit by the pandemic. In Manitoba, 61% of people with COVID-19 are Indigenous. Here's what the Minister of Indigenous Services had to say earlier today.
While the vaccines have started to become more available in Canada, their rollout can't happen fast enough. As of January 12th, we are aware of 4,384 active cases of COVID-19 in First Nations communities on reserve, for a total of 11,502 confirmed cases since March. The numbers continue to rise, with over 800 confirmed COVID-19 cases on reserve over this past weekend. These numbers continue to be alarming and have now exceeded the national average, and will continue to do so if gone unchecked.
But money and goodwill can't overcome one of the biggest challenges, administering the vaccines in Indigenous communities. For some community members, the medical system has left scars that run deep, and those past traumas have led to a lack of trust. For more on this conversation, we're joined now by Joe Hester. He's the Executive Director of the Anishnawbe Health Toronto Health Clinic in Toronto. Joe, thanks so much for being with us. Your clinic is actually administering the vaccine, so I want to know what you're hearing from community members when they come into the clinic. Are they eager to get it, or is there a lot of apprehension?
Well, first of all, we have a significant population in Toronto, of 70,000. And we were able to provide some vaccines to our elders in the community who are resident in a complex, and we did a little bit over 100 vaccinations yesterday.
And was there an eagerness to get those? Were people lining up out the door to get them, or did it take some convincing?
Not this particular population group. Whoever showed up, of course, would be eager to get the vaccine. But having said that, I don't think that's a blanket kind of statement you can apply to the whole population. There has been, talk about the hesitancy factor, and when we develop our strategies in terms of vaccine rollout, we're taking that into consideration.
And when you hear that hesitancy, what's usually at the root of it? What are you hearing from people who are skeptical and apprehensive about taking the vaccine?
I think we can maybe capture it in two ways. One, there's a natural hesitancy for anybody to get something sharp poked into their arms. So there's that natural hesitancy. But I think, for a large part, ours may be a historical one, where, the interactions we had with the newcomer was largely, a trauma event. And that has remained in the minds and hearts of our people, and has been part of the information, communication on down to generations to today. The imposition of government from a different culture, just completely dismissed our governance aspects that we had in our communities. And it was stripping of our culture. There were what we would call, I guess, an unfair kind of practice in terms of Inuit people being stripped their skin, in terms of they're just experiments, and these kinds of experiments didn't have a parent or whoever to be able to give their okay on it. That was just ignored.
Yeah, talk to me a little bit about some of those specific cases that maybe some Canadians don't know about, the history of some of this, medical racism that Indigenous people dealt with over the, decades. Tell us about some of those. You mentioned the medical experiments.
Yeah, I think when I talked about the the skin grafts that were done to the Inuit people, also in terms of people having to go out of their own communities to access medical care, and all these kinds of things, like the the legacy of residential schools and what happened there. Our women were forced or coerced in terms of in terms of their being able to conceive.
They're sterilized, yes.
Have children, yes. And these were all forced kind of things, and a lot of the even till today, we have hospital staff betting on blood alcohol content of patients who come to see them. And so there's a natural fear there. The minister spoke earlier about Joyce Jacquemin from Quebec who lost her life, and people around that area didn't want to go to that particular hospital again.
Right.
They wanted to go to another facility. That kind of thing shouldn't exist in our country.
So there's a general sort of mistrust of government, of medical officials, and you mentioned that this is not just in the past, but how medical professionals today contribute to that fear. Talk a little bit more about that, the stereotypes that Indigenous people often face in the medical system when they try to get care. So we're not just talking about vaccines, but maybe even if they are dealing with COVID-19 or other types of illnesses while presenting in the medical system. What do you hear?
Maybe I can give you an example that's happened in our community.
Sure.
Not too long back, one of our community members, she went to a hospital, and she, had symptoms of stroke, minor stroke, and she was told at the hospital just to go home. There's nothing wrong. And she went again and was told the same thing. Unfortunately, she had to ask a non-Indigenous friend to accompany her to the hospital. Then and only then did she get treatment.
Wow. So back to the conversation around the vaccine specifically. You are administering them in your clinic. What are the conversations that you have with people? How do you try to overcome that? And in general, how can the government and the medical community help rebuild the trust with Indigenous people in Canada?
I think, you have to recognize that if we can provide the access to vaccines, as an example, and so they see us, and so there's an automatic trust and being able to know each other, and so they have that confidence and trust in our delivery of services. And I think we have to be at the lead of dispensing of vaccines.
Right.
Otherwise, you're going to run into these kinds of issues that I talked about earlier, and you don't want that kind of situation, particularly when we're trying to get vaccines to people.
All right, Joe, we're going to leave it there. Thank you so much for speaking with us. That's Joe Hester. He's the Executive Director of Anishnawbe Health, and he joins us tonight from Toronto.
Thank you.